This is May Day, 1st of May 2025. Happy new month to you and to yours. Hope you're good out there. It's 9:52 in the morning. From wherever you're watching us from, thank you for joining us. We would switch gears to some discussion, especially as it relates to health, immunization and disease infections among children. We have with us live in the studio Dr. Obinna Nduagubam is a consultant pediatrician. Good to have you. Good morning.
Good morning. Thank you for joining us, our viewers.
Interesting. I mean, when you speak of immunization, a whole lot of persons would feel, well, mostly it's basically about things that's got to do with kids. How much do you know, from your experience, how much of these types of things do you think the Nigerians know about, and how do they react to issues relating to immunization?
Thank you very much, and good morning once more. Well, I think Nigerians know about immunization. I think the basic thing they know, and most people can attest to, is that they know that there are vaccines or there are jabs or oral medications that are given periodically at what they call immunization centers, which we know have several of them in different parts of the country, and that those medications are administered in order to prevent diseases, infections. And they know, well, most of them are given from childhood, but there are still some that are also given even at adulthood, and for several other reasons, depending on what is available at that time. So basically, yes, a good number of them are given in childhood, but some are also given even beyond childhood. And depending on the situation, we may have an outbreak of a disease for which, depending on the herd immunity, there may be a mop-up for both adults and children. One may have a need to travel out, and as part of the requirements for traveling, you may need to have certain jabs to show that you are protected from certain diseases as you travel out of your country. But basically, what people know mainly are the vaccines that are given in childhood, and I think that's what is the major discussion this morning. Yes, and like I would say, vaccines are, in fact, is the most important intervention that has occurred world over in the world of medicine and health. The advent of vaccines brought about a change, a drastic change in morbidity and mortality, that is deaths and dysfunctions of parts of the body arising from certain illnesses. And so for diseases that are preventable through vaccination, we label them vaccine preventable diseases. Okay, and a good number of them are what we cover under our national program on immunization. Okay, Nigeria started with the expanded program on immunization in 1979, and then moved on to the national program on immunization, which is what we have. And we have a lot of vaccines with boosters, even at intervals, to help protect children from diseases, a lot of vaccine preventable diseases. And
Absolutely.
Of course, that has brought about a lot of change in the percentage, deaths we used to record before the advent of these vaccines or introduction of these vaccines.
So the national coverage has actually improved?
Yes, it has done. In fact, in Enugu State, we have over 80% coverage.
Over 80%?
Yes. So, well, and that is impressive. But again, that's for vaccine preventable diseases. So there are a couple of other diseases that you may not have vaccines for. And again, the presence of vaccine, like many people may not know, doesn't necessarily mean that those diseases may not occur. But their chances of occurring is a lot reduced. And the severity of those diseases, when they occur in people that are vaccinated, are usually milder.
Okay,
so that's the thing. And then when a large population of the people are immunized against a disease, it also offers some protection to the smaller percentage of people that are not immunized. That's what we call herd immunity. When you have about 85% of the population already immunized against a disease, that remaining 15% that have not received the vaccine, for some reasons or the other, also have some shared protection. That's what we call community immunity or the herd immunity. Okay. Now, it's good for us to mention at this point that vaccination doesn't necessarily mean immunity. That I'm vaccinated means I'll receive the jab against a disease, I've received a vaccine, be it a jab, be it introduction through the mouth, I've received a vaccine. That's vaccination. But whether the vaccine I received is able to offer protection, that's what immunity is. That's immunization now. So some instances, people use these two words interchangeably as if they are the same. They're not necessarily the same. So receiving a vaccine is vaccination. Having sufficient protection from that vaccine is immunization. So it's expected that by being vaccinated, you should get immunized.
Yeah.
Okay, but there are certain things that may account for being vaccinated and not being immunized, or the percentage immunity that you may have from a vaccine. Okay, that is why some vaccines have what we call booster doses. You have periodic administrations of doses of the same vaccine at intervals. That is a way of increasing your percentage protection against that disease. Fantastic. Okay, and it's very important. So some people may have a vaccine that you're supposed to have 5 doses. Take, for example, tetanus vaccine, what we call the tetanus toxoid. Okay, if a mother that is pregnant is supposed to receive 5 doses and she receives only 1, she only has a small percentage, about 50%. By the time she receives about 3 to 4 doses, she comes to about 90%, 95%. And then at the 5th dose, she has about 95% protection. So you may have a mother that may receive the first dose and subsequent doses she does not. And then when you now ask, I say, I received the first, my tetanus toxoid. You understand? But it doesn't mean that she has obtained the maximum protection, that's the immunity, that she would have obtained from that particular vaccine. And so she's at increased risk if she's exposed to that particular organism of coming down with tetanus. And that's why it's important that in as much as people know about vaccines, people avail themselves of them, even though we have people that have issues, we have myths, what to call myths, wrong impressions that people have contrived against vaccines. Okay, so apart from receiving that vaccine, you must complete the recommended dose, have booster doses so that you can have that sustained protection. Okay, otherwise the tendency to still come down with that disease is high. But world over, with the advent of vaccines and the miracles they are doing, a lot of our children that would have died before their first 5 years of life, okay, or before their first 2 years of life, a good number of them, much large percentage of them are saved. And that's why the picture is a lot different.
Right. Can you talk us through the immunization processes or the dosages that a kid should take between when they were born and 5?
Okay. Now, the timings, these are things we teach in medical school. At birth, a child should receive the BCG. That is the Bacillus calmette-guerin. That's against tuberculosis. And that one is preferably given within the first 3 days of life. Okay, along with the 0 dose of hepatitis B. Okay, and then the OPV 0, that is oral polio vaccine. That is at birth. Then at 6 weeks, the child will receive the oral polio vaccine 1. Okay, and then what we call the Penta. Okay, the Penta contains 5 vaccines. Okay, diphtheria, pertussis, tetanus, hepatitis B, and then the Haemophilus influenza. Okay, so it comes in one package, 5 vaccines in one. It makes for ease of administration, compliance. Okay, and then the person also receives the rotavirus vaccine. Okay, now because rotavirus is still being paid for, to some extent, not everybody receives. Okay, it's not part of the free vaccines that people are accustomed to. Okay, then at 10 weeks, the person will also receive oral polio 2, Penta 2, okay, and then the hepatitis B vaccine. Then at 14 weeks, he receives exactly the same thing at 10 weeks, and then what we call the IPV, okay, inactivated polio vaccine. Even though he still receives the oral polio, he still also receives the inactivated polio vaccine. Okay, then at 6 months, the child will receive vitamin A. Okay, a good number of them may not come for that vitamin A, because even though vitamin A is not a vaccine, it's so important that it is added into the immunization schedule because of the importance of vitamin A for the child. The eyes, the inner lining of the gut, the skin, and general body function. So vitamin A is so important, and there is a very high percentage of vitamin A deficiency severe vitamin A deficiency in Nigeria and in Africa. In some cases, reaching up to 25% or more. And that is quite worrisome. Okay, so you have issues with vitamin A, night blindness, and what have you. So vitamin A is so important, even though it's not a vaccine, that is included in the immunization schedule. Then after the 6 weeks, at 9 weeks, the child will receive what we call meningitis vaccine. Okay, along with the yellow fever vaccine at 9 months. Okay, and then at 1 year, the child will also receive second dose of vitamin A. Then at 15 months, the child will receive the second dose of measles. Sorry, at 9 months, meningitis, yellow fever, and measles. Okay, and then at 15 months, then second dose of measles, what we call the measles conjugate vaccine. Okay, so thereafter, a child is expected to receive vitamin A every 6 months till the child is 5 years. Okay, unfortunately, this is not covered under the MPI per se, but this is part of the World Health Organization's recommendation for vitamin A supplementation in children. Okay, so in our own, yes, in our cards and in the immunization center, they account largely for the first and second doses of vitamin A at 6 months and 12 months. The subsequent doses that should come every 6 months till the child is 5 years will now come either when they are doing their MNCH week, maternal, newborn, and child health week, which is done twice a year. Okay, that represents that 6 monthly subsequent doses till 5 years. But the problem that many of us have observed and are still challenging is that a good number of children may not actually be covered within that period, that week. Okay, and a lot of resources that are deployed in trying to have that reach out as against children coming to the immunization center to receive those vaccines, get assessed, check their weight, check their growth, know if there are challenges in that child that are observed, make appropriate referrals. So we advocate that such subsequent doses of vitamin A are better if they are given in the immunization center. Yes, we know the challenges are there with respect to funding, transportation to those centers as often as it should. But if you look at it on the long run, it's in the best interest of that child, because there are a lot of things that the mothers may not appreciate, which such visits will pick, and then flag them if it's beyond what the immunization center can handle. Nutritional challenges, growth challenges, overt illnesses that may require referral. Okay, so apart from the vitamin A that is given 6 months to 5 years, we also talk about the herpes virus vaccine, which is given at 9 years and 14 years for the female. And we know that it is a very happy human papilloma virus vaccine, and it's very important for preventing cervical cancer, which is a leading cause of death among our women in Africa. Okay, it's one of the things that the single most important factor that has been found to help prevent against cervical cancer in our mothers. So we advise our mothers, our mothers and our parents to avail their children of these vaccines, which will help reduce the chances of coming down with these vaccine-preventable diseases, and very importantly, also protect them from infections generally, like the vitamin A, and then the HPV that protect the child from coming down with cervical cancer later in life.
Right. I mean, I'm sure you are conversant with vaccine hesitancy, fueled mostly by misinformation and some cultural practices. How has that affected the level of immunization across board?
Well, it's been a constant battle. People construe all manners of things, and they spread it out. And of course, in this world of social media and a lot of avenues to spread information, such information can actually go very far. Okay, and it gives a heavy blow to the general immunization campaign. Okay, as advocates in Enugu State, immunization champion in Enugu State, under the Political Association of Nigeria, a lot of advocacy is on. Okay, and then the immunization program in the state and in the country, at national level, there's a lot of advocacy going on, so that people can actually get the right information, seeking them through the right channels, and not picking information from roadside people that give information that don't have any scientific backing, okay, and don't have any substance behind that, no proofs, no evidences. So a lot of effort. So these things, yes, they affect the program, because those the uneducated, the less, exposed in the rural areas, they may pick some of these wrong information and go with it. It may make them to avoid, run away from vaccines. They may incidentally now have someone that had maybe a reaction, or, one in a million that may have had a serious side effect from the vaccine, and they pick it up. They forget that there is nothing that doesn't have any, even vitamin C has side effects. When you lick a lot of vitamin C, you have some, cuts on your throat and so on and so forth. Okay, so the vaccines are not to say that they are completely, trouble-free, but if somebody has, most of the things you may have in vaccines, if at all, are minor complaints. Oh, fever. A child becomes restless and crying following, penta, because of the pertussis component. Okay, a child has a swelling at the site of the vaccine. Rarely do you talk about more serious things like convulsion, okay, going into shock following the vaccine, what we call anaphylactic reaction. Okay, and so very rarely, less than 0.05% will have that. Okay, and we now look at those things, juxtapose them with the huge, undeniable positive effects of the vaccine and its protection, then you realize that they are incomparable. There are no basis for comparison. Okay, so people are always encouraged to seek information, right information from their health care professionals, from their doctors, from their nurses, rather than hearing from people by the side, neighbors and so on, people that have warped ideas about vaccine, because there are a lot of myths,
right?
And these are actually wrong information being passed. And some of these things are passed not necessarily that the person has a bad motive, an ulterior motive, but because the person that is fielding or spreading information is actually uninformed. So the person is passing information from an angle of ignorance. Okay, on some occasions it may actually be a kind of disinformation. Okay, because there are different misinformation and disinformation, whereby the person is actually doing that with the aim of causing harm to the recipients of such wrong information. So such both sides occur, passing wrong information unknowingly and passing wrong information with the purpose of, harming the recipients or denying them what is or should actually have been helpful to them. So all these are known, and huge efforts are being made to ensure that people have the right information, can source the right information, can approach the healthcare workers and be availed of the right information, and that they practice what is in the best interest of their child or what.
Right. Do you think insecurity in faraway northern Nigeria stop immunization or hamper the success of immunization in those parts?
Thank you very much. Yes, insecurity remains a big issue, and we can't run away from it. With insecurity, the facilities that are existent in those areas will not be able to function because they are run by humans. Okay, they need to protect themselves as well. Even those that will access those facilities will not be comfortable because they need to safeguard themselves first. Okay, and then even when you try to reach out to those areas beyond just using the immunization posts and centers, it's still an issue because with insecurity, access brings an issue. Okay, so it's a huge problem when it comes to the coverage of immunization. But you see a lot of health workers that still go out of their way, out of passion for what they believe in, trying to see how they can break some of these barriers. But whether it's the problem, it is a very big challenge. And beyond insecurity, there are other issues, level of education and exposure, okay, social and cultural beliefs, okay, that are not in tandem with scientific proven knowledge and practice. All these things hamper what people do. We talked about access. It could even be the access road, okay, being able to actually get to these remote areas because they are virtually, the roads are not accessible, okay, they don't have a means of movement, okay, or even how to preserve these vaccines in very remote areas where they don't have power and so on and so forth. These are a lot of challenges. So, but be that as it may, effort is being made to see that as much as possible, these people are reached. Okay, but like you mentioned, health cannot improve in isolation. All these sectors have to improve together. We cannot have a natural health system that is growing and doing well. In the absence of security, in the absence of good road network, okay, potable water, good governance, okay, if there is poverty, malnutrition. So all these things, they work together. Okay, there is what they call intersectoral collaboration. We have the ministries and departments or the sectors coming together to achieve that overall welfare and well-being of the individual. So it's a big issue, and the immunization program at the national and state levels try to see what they can do. There are no states without areas, pockets of areas where there are some level of insecurity. Okay, and it remains an issue trying to overcome the challenges that it poses.
What for you is the role of healthcare practitioners and facilitators in making sure that this kind of information get through to those in the rural areas?
Very important. Yes, it's an unending, effort. It's just like a battle between what is right and what isn't. Okay, trying to make sure that people have the right information, have access to what is. So just like in Enugu State, we have immunization champions under the Pediatric Association of Nigeria, and there is the same in most other states. Okay, so in every opportunity they have in social media, be it WhatsApp, be it Facebook, whatever social media accounts they have, they advance information on immunization. Okay, they make sure they create awareness about what is available, where you can access them. Okay, and then they show that they answer people's questions, not from the angle of what they think, but from what is the authentic information that is verifiable. Okay, at the rural areas, local governments, ward levels, we have all manners of things that we have in place. Okay, we have immunization officers that try to do outreaches. They try to reach out. So they don't wait for these persons to come to the immunization center alone. They also try to reach out to them. They use town criers. They use the religious leaders in the communities to create awareness. Okay, they use the traditional rulers. They use the president generals of town unions and other key influencers, opinion leaders in the community to advance the correct information, to make people to know what should be, to make people come out, okay, and access the available facilities. So it's a robust, it's a very well coordinated process, complex as it may be, but it's a well coordinated activity that tries to reach out to the rural areas and see that people are aware and access this. And we'll talk to mothers at different levels. August meeting, church women of decision groups, okay, and even in churches, health workers are advised to do what? To give health talk in churches. Then at the health centers in the rural, in the PACs and in the villages, the nurses and health workers, they also give health talk on general matters, including immunization. And we encourage that as you go home, don't just keep the information to yourself. Talk to your neighbor. Talk to the other person next to you who may not have an opportunity to be part of that information dissemination, so that they know. Okay, and if they have issues, this is where they can come to. They have questions, so that those things are clarified. So it's a very big thing, but a lot of challenges a lot of things are making people find it more difficult to even access right information. When a woman cannot even feed her children and she has to transport to the nearest health facility, it becomes an issue. Okay, and so many other things. So the poverty index is worrisome. The degree of malnutrition is alarming. Okay, and all these things are rubbing negatively on the efforts being made in creating that access to vaccines, which will now lead to immunization that we all desire. So these are issues.
Most parents don't fully immunize their kids. They immunize their kids. They know the basic ones, but they don't fully immunize. I'm sure that some persons, it's the first time they're hearing they'd have to immunize up until 5. For the one you mentioned, every 6 months up until 5. What are the dangers of not fully immunizing a child?
Well, just like I've mentioned, the other danger there is that child may not have optimal protection from that disease which the vaccine would have offered optimal protection for.
Oh, okay.
That is one clear danger there. And then what it means is that child whom the mother thinks may be protected from a particular disease is obviously not protected. And that child can come down. A good example is tuberculosis. Okay? You still have children that still come down with tuberculosis, particularly with malnutrition, okay, with immunosuppression from maybe picking up HIV or other immunosuppressive illnesses, okay, malnutrition, living in certain conditions that are, not good, overcrowded environment, places that are not well ventilated, living in the midst of people that adults are already having TB and are coughing, openly. All those things will expose the child to tuberculosis. So it's very obvious. If a mother starts a vaccination for a particular disease, against a particular disease, it is advisable to complete that vaccine in line with the schedule. And that is why when you come and receive a vaccine, you are told when to come back. Every mother is informed when to come back. Now, the only problem we have is that we don't have an established process whereby a mother that hasn't come when he or she should, or expect you to come back in a month's time, say 1st of June 2025, having given you a vaccine today, and by 1st of June 2025 you've not come, we don't have really that process where a health worker will call the mother and say, Mrs. Okeke Okafor, you were supposed to come back today, we've not seen you. What happened? So that follow-up process is not there. And those things also come with a lot of cost.
Right.
Okay, and we don't also have active processes of driving and getting these people to access these vaccines. So these are the loopholes that are there. In other parts of the world, those calls are made. Because they are advocates for the child. So as a mother, you don't just deny a child what is actually her due for some freezing reasons. They will access you and the child will be given that opportunity to get immunized.
Dr. Obinna Nduagubam, many thanks for your time. Thank you for your insight on this particular topic. I mean, it's your environment, it's your turf. I wish I could ask a little more questions, but I'm sure that we're going to leave this for some other time again. Many thanks for your time, sir.
Thank you for having me, and thank you, our listeners and viewers.
Save Nature TV. News in your pocket.